Hello everyone, this is Dr. Kant Shah here, pediatric surgeon, and today we are going to talk on a slightly serious and slightly entertaining topic. Okay, if you are a parent and you are sitting in a room with a surgeon and we are talking about surgery. And so how do you as a parent cope with this? Okay, there are parents, we've seen like over 20 years, I've seen all kinds of parents. There are some parents who are like, okay, surgery karna hai, kab karna hai, kal kar do, khatam. So some people are mentally prepared because they have been counseled by their referring doctors, or they have googled themselves and they have made a self-diagnosis and they have realized that they need to undergo surgery or the child needs to undergo surgery. But there are some parents who cannot take it. They are so anxious and that anxiety is building into them and they are just waiting for me to utter that word surgery in a very filmy way. They just go, surgery? They know they have come to me for surgery. They know they are going to a pediatric surgeon. They know that surgery is going to be required, but still they somehow cannot accept it. And there is a fear and anxiety, which is completely understandable as a parent. But they are not cognizant that there is a child sitting there. And fear and anxiety is very easy to pass on. If I just start roaming around creating fear and anxiety, 10 other people will get it. It's the same in your family also. If you are fearful and anxious all the time, it will happen to your husband, wife, to your children. But this is particularly a time not for gimmicks and filminess. Okay, this is a time where you have to be a little more serious, because if your child has been told surgery, then you have to have some kind of a barrier between the discussion what you can have with a doctor and what the child can have with a doctor. You need some sort of a barrier where you gather yourself first before you continue to have a discussion. Why? Because your reactions will affect your child. Your child should not feel, oh, they are just sending me for surgery. The child should not feel, my mother is crying, something is going to happen to me. The first thing that happens when the child sees their father or mother crying is they get scared that something horrible is going to happen. And if some pediatric surgeon has suggested surgery for your child, it is extremely likely that it is going to be beneficial for the child, and it is in the child's best interest. So with that background data in your mind, when the surgery is suggested, it is best to just have that little distance between your thought and what you say, so that you don't spread the anxiety. It's okay to be anxious, just don't spread it. There are some parents who first thing, today it only happened in my OPD, the mother got up and said, child, you please go out. The 10-year-old child, he knows what he wants in his life. He even knows he wants to get into politics. Itna hoshiyar bachcha hai. Mother is telling him, go out. So parents have to understand that children today are very curious. They know more about things than you and I do, actually. Okay. He will Google it in 10 minutes and he will know more about his condition than even I have not Googled it for maybe a month, and he will know better than me. Forget the parents. Forget you as a parent. So make children part of the process. That helps to reduce the anxiety. You as a parent, don't impose your anxiety onto the child. Take a deep breath. Just don't speak for a bit. Understand what is being told. Listen. Most important is listen. And then you can ask any number of questions that you may have. There is no restriction on the number of questions you can ask. There is no restriction on the number of opinions you can take. But go with a single mindset that I will follow what a doctor says. I will pick my doctor and I will follow the doctor. See, as a pediatric surgeon, we don't just say surgery. No? We have put some time and effort into learning what we are doing, and then we have suggested surgery. Of course, as a parent, nobody would want to operate on any other child. So we understand where you are coming from. We understand your anxiety. And it's completely okay to be anxious, but to spread that anxiety will cause confusion in the child. And then I'm telling the child that I will make the child better. They will be like, no, but my mother or father are crying, so how can you make me better? And then instead of having a scientific discussion about the surgery, and I'll tell you, today children want to know absolute details of anesthesia. How will I be anesthetized? What will happen during surgery? Will I feel anything? Will I have pain? When will I wake up? And we have to answer all these questions one by one. We cannot skip these questions. Will I have pain after surgery? How long will the pain be? When will I go to school? When can I play? And honestly, I made a very nice video for your child, speaking in a child's language on the same thing. So please watch that video, or make your child watch that video rather. So you want a discussion to go into this direction and not confusion where the child feels that my mother or father are crying. This doctor is telling me he can cure me. How can this doctor cure me? My mother and father are obviously more important for me and not the doctor. So we want to build trust and we want to build a relationship with the child, because so they can cooperate, that And in a very scientific way, it reduces the post-operative stress. It reduces the doses of anesthesia. It changes what kind of anesthesia we can give. It reduces the impact of anesthesia on the child, and it impacts the wakefulness of the child after the surgery. So only from a purely anesthesia point of view, it is very important that child is part of the process. From a surgical point of view, I want that child to know that there will be some pain. We will overcome it very easily with simple medications. And I expect the child to walk, especially after laparoscopic robotic surgery these days. I want every child to walk within 24 to 48 hours after surgery. So I need that child and you to be a part of that process. Now, if the child is living in fear of pain and they have unanswered questions, there will be some delay in walking. Delay in walking means they can get a chest infection, their intestine will not work very well. They may have more tubes put in because they are not mobile. So all this makes the recovery worse. Today we are living in an era where we want early recover after surgery. It's called ERAS protocol. We want the child to go home fast. We want the child to go to school fast. So we want minimal complications and we want maximum outcome. And for this, the child has to be a part of the process. For this, you have to be a part of the process. The first thing that we expect from you is to control your anxiety. You can be anxious, control your anxiety, take a deep breath, ask whatever questions you have as many times as you want, but then eventually soak up the news, involve your child. Then if you're really not convinced, get a second opinion. But make a firm mind to listen to the doctor, whatever the doctor is saying. And this will really help you in making better decisions for yourself and for your child. So to summarize, every doctor needs to have two discussions, especially with an older child. One is with a parent that you and I will have in a very scientific manner. You can ask as many questions. And then you will see that the child will have their own set of questions which we have to answer in a different language, and we never want to lie to them. Okay, we don't lie and you should also not lie. I had one parent telling that child, oh, they will just put a little hole in your bum and do the surgery. That's really wrong. That's not how surgery is done. Don't tell them something that is even more scary. So don't innovate, don't create new things. We are qualified enough to talk to your child. You can learn from us and speak in the same language, but most importantly, please don't lie to your child. I hope I have helped you in reducing your anxiety to some extent. Of course, you can come and talk to us every time about this whenever you need it. And please spread this news to other parents also, that if your child has been suggested surgery, take a deep breath, just control your anxiety, ask as many questions as you want to the pediatric surgeon, and allow your child to be a part of the process. So thank you for listening so far, but I'm sure you got more questions, so please write them down in the comment section and I will answer each and every one of them. And please like and subscribe my channel. Thank you. Bye-bye.